Today's Seniors is sponsored by Blue Cross Blue Shield of North Carolina.
There are many things to consider when you're looking for a senior care community for a loved one: cost, safety, and now staffing.
That's right. There are staffing shortages everywhere in every industry. So how do you know if the care facility you're considering is properly staffed? And for that, we turn to aging expert Anthony Cirillo for some answers. Thank you so much for being here today.
My pleasure to be here.
Well, how serious is the staffing issue in senior care facilities?
Well, it's always been an issue, but it's got exacerbated. We'll use a nice big word for it. During COVID, there was a recent survey from one of the associations, and it said that over 90% of nursing homes and 80% of assisted living have seen severe staff shortages, kind of increase since the pandemic and post-pandemic. The thing is, this is nothing new. One of the first appearances I had on this show was to talk about my book. It was called Who Moved My Dentures? and the book's kind of dated now, but I'm going to just read you a quote. And this book was published in 2003, and it said, "The biggest problem today," one of the quotes in the book, "is staffing, and it applies to all states. Years ago, abuse was the biggest problem. It still exists now, but the bigger issue is neglect because of inadequate staffing and poor work ethics." So what's changed in 2 decades? I mean, it's definitely a problem, but COVID brought out a few things. Trust in nursing homes eroded because there was a lack of transparency in terms of communication with loved ones about what was happening. People started taking mom and dad out of these things. They stopped considering them. A third of people who were considering these places said, we're not considering them anymore. And so what happens then? The census goes down, revenues go down, staff is cut, the people who are there are left to do more, they burn out. So, you can see the tumbling effect. So staffing is absolutely important.
So where do you start to evaluate here then?
Well, the first thing you need to know is that when you have better staffing, lots of good things happen. Fewer medication errors, fewer medical errors, fewer deaths, shorter stays for rehabilitation patients, less burnout among staff. So there's lots of benefits when the place is fully staffed, better patient satisfaction. But there are things that you obviously can do. The first thing to start is get help. So there's a profession, they're called geriatric care managers, and these folks can actually help you, guide you into planning for mom or dad. In fact, a lot of estate attorneys employ them in their offices, so they can kind of help guide you with a plan. And so you might want to look at those. And if you're going to then go tour a facility, you might want to consider, do you have an RN, a nurse who is around that can help you go and ask the right questions? Assisted living is not as regulated as nursing homes, so there's not a lot of baseline information. But for nursing homes, there's something called the Center for Medicaid and Medicare Services, called CMS, but they have something called Nursing Home Compare. And so you can go on their site, and it's a 5-star rating. So a facility with 5 stars has better quality, and staffing is one of the ratings that they use. Now, it used to be that was self-reported, and there was a lot of, not accurate reporting. So that has changed. It's now actually tied to the payroll systems of these places. So you can get a bird's eye view of kind of what's the staffing. And U.S. News and World Report actually has a top list of nursing homes and even a more refined criteria. So there's 2 places that you can at least start to say, there's 100 places around this area. Can I narrow it to 3 or 4 that I actually want to go see?
So if you go in person, what should I be trying to observe if I go in person?
Well, there's lots of things, but just from a staffing level, you want to kind of understand what it is that they're doing. So again, the government has kind of minimal standards that they want you to follow in terms of how many certified nursing assistants per resident, that kind of thing. New Jersey in 2020 actually put more stringent guidelines. They say they want a certified nurse assistant, 1 for every 8 residents, and in the evening shift, 1 for every 10, and the night shift, 1 for every 14. So jumping block for questions is, what's your staffing ratios? If I go in, how many certified nursing assistants per patient? How many LPNs and RNs do you have? How are they trained? What is the turnover? How many temporary people do you use? That's a big consideration. You can't get away from it in a lot of places, but how often?
And how often do you check on the on the person that's in there? And what about food and situations like that?
Well,
right?
yeah, exactly. And patient care, handoffs during shifts, things like that. Do they do criminal background checks as well? Again, you may want to take a nurse with you. And the other thing, and you wouldn't think of this immediately, but ask if it's a for-profit or not-for-profit facility. There's enough studies out there that show not-for-profit facilities have better quality. And it's all the natural things you would think of, because they're not as concerned with profits, so they're going to put more back into the facility to better staff it, better quality, less errors, more satisfaction, better place.
Thank you so much for being here with
Sure.
us today. And you can go to theagingexperience.com for more.